Hello everyone, I am Dr. Raghu Nagraj. I am a Senior Consultant and Director Department of Orthopedics at Fortis Hospital, Cunningham Road. I am here to talk on common sports injuries, what is sports injuries and how to prevent them basically. Sports injuries means injury to any structure of the body. It could be a joint or it could be a bone or tendon, ligament or cartilage structures inside the joint when the person is involved in some activity. It's not necessary for sports injuries to happen only while playing sports. It could happen when the person is like coming down from the stairs. If they lose balance and if they fall down, they can injure their ankle, they can injure their knee ligaments. They are also come under sports injuries. Basically, we define injury to any ligaments or any structures around the joints, like this is the ligament which connects the two bones. So the injury could be to the ligament, or the injury could be the tendons around the joint which moves the joint. Or sometimes the injury could be to the cartilages or the shock absorber between the two bones due to the twisting movement while playing sports or when they climbing stairs when they fall down. It can happen in road traffic accidents also. So generally sports injuries depends on how severe the injuries is, whether it's a mild, moderate or severe. Mild injuries like a sprain can be treated at home, like giving rest to the part or putting ice pack and putting compression bandage around that part that is injured, like a crepe bandage support. And finally, leg elevation. Elevating the leg above their body level decreases the swelling and thereby reducing the pain. If the pain is a little bit more, if they are not able to put weight on the structure damage, that is ankle or the knee, one can also use a walker support or a crutch support and put support around the structures like kneecap or an ankle brace. This will help in bringing down the pain and also supporting the structures that is damaged, thereby helping in healing the structures. If the injury is really bad, like one hears some kind of a pop sound or kind of a giving away in the structures around the knee like ligaments or around the ankle, or it could be due to in the shoulder also. When something major happens, then it's advised for them to visit the hospitals so that we can assess what exactly the structure that is damaged. Depending on that, we can take the treatment accordingly. Most of the times it's conservative treatment, like as I said earlier, rest and support to the part, and also once the investigations are done like X-ray and MRI, we'll get to know exactly what is the grade of the injury. Depending on that, we will take the call accordingly. In some rare cases where the tear is complete or if the injury is really bad, causing locking around the knee or causing severe instability around the knee or ankle, then we consider doing a surgical repair of that ligament using a technique called arthroscopy, which is a minimally invasive keyhole surgery technique where we'll make a small hole around the joint and looking in the camera, we repair the structures that are damaged. So how should one prevent such injuries is by doing regular exercises. It has to be regular warm-up and stretches initially, followed by strengthening exercises. And one should also focus on balancing or proprioceptive exercises like running zigzag or side-to-side running or balancing on a wobble board. All these things will increase the reflexes between the mind and the particular joint, thereby preventing the injuries. The basic concept is when they lose balance, they should be able to correct the balance so that they don't end up in getting injured. So this is how one can prevent sports injuries. Thank you.